Hello, my name is Lauren McCarthy, and for this assignment, we were asked to go to the website Teach Engineering and build a model of how the lungs function. So here is the model that I built. I did use a smaller bottle because I couldn't find a bigger balloon, so it doesn't quite work, but the whole concept is that essentially um, when you pull down on the bottom of this, it is supposed to inflate the lungs. And then when you push up on the bottom of the balloon of the model, it's supposed to show the process of when a person exhales. So unfortunately mine doesn't seem to work very well, but you kind of get the idea of it. So I'm just going to go into a little more detail. And then for this, so the different parts of this is showing that the straws here are the bronchi, which are essentially the shuttles that are the areas that shuttle air to and from the lungs. The small balloons that are inside are supposed to represent the lungs, and that is what provides oxygen to the blood. And then the large balloon that is on the bottom is supposed to represent the diaphragm. So as the diaphragm goes, as people breathe in, the lungs should expand, and as they exhale, the lungs should decrease in size. So essentially, the mechanics of breathing is that both inhalation and exhalation depend on the pressure gradients of the lungs and the atmosphere, as well as the muscles within the thoracic cavity. So just to briefly discuss what inhalation is, when you inhale, when you inhale or when you breathe in, the air enters your lungs and oxygen from the air moves into your lungs and into the blood. And at the same time, the carbon dioxide is also moving to the blood, is from the blood to the lungs is exhaled. This is called gas exchange, and we all need this to function in life. So this process occurs to increase the lungs and the volume. The diaphragm contracts and the chest wall expands, which results in a decrease in the lung pressure in comparison to the atmosphere. And so the air actually rushes into the lungs. Exhalation, the process of exhalation is just the opposite. So as the intercostal muscles relax, this causes the rib cage to move down and in. The diaphragm relaxes, and the shape of the diaphragm is like a dome. This causes a decrease in the volume of the rib cage and increase in the air pressure. Once the air is released from the lungs into the external environment, the lungs deflate, and that's the process of exhalation. So another thing to consider about lungs is that there are different, people can have different sizes of lungs. Some lungs are smaller, some are bigger. In essentially every human, their lungs mature around the age of 20 to 25 years old. After that, the lungs start to decrease in size. After 35, it is normal for the function of the lungs to decline, which can make breathing a little more difficult. And also, if in comparison for gender, males tend to have a larger lung capacity than females, but that's just because of the size of them. Although the females have smaller airways at birth, they have a lower specific airway resistance. So it actually shows that female fetuses have a more mature phospholipid profile that reflects the production of surfactant, which is needed to make sure that the lungs expand after birth. It is also noted that African Americans do have a larger lung capacity and lung size in comparison to other races. So one of the diseases that can affect the lungs is asthma, as we've talked about today during stimulation and obviously all throughout the week. So asthma is a disease that affects the airways of the lungs, and it's essentially where the lining of the lungs and the airways tends to always be in a hypertensive state. that is characterized by redness and inflammation or swelling. One of the things that can make the lungs react this way is if there's triggers. So some triggers could be considered chemical irritants, allergens, the air quality. If there's smoke in the air, animal dander can also affect or have a reaction to where people have an asthma attack. So when one is experiencing one of these triggers, the inside of the airways become more swollen, which is the inflammation. The narrowing of the space for there's a narrowing of the space for the air to move within the lungs and out of the lungs. The muscles that wrap around the airways can also tighten, which makes breathing even a little more difficult. Once a person has an asthma attack, the person is usually more fatigued, and they are also at risk for having another flare-up soon after that episode in the days following. So it's always important to monitor symptoms and always check your airway using a peak flow meter. As for the managing of nurse management and the priorities, assessment and diagnosis is based on if there's a family history, some environmental factors, like I mentioned, that, if there's something in the air that you're allergic to, or it just, kind of gets your lungs inflamed, those are always things to note. And then for some of the pharmacological therapies that can be used, there is the short-acting beta adrenergic agonist, and then we've got the corticosteroids, there's the leukotriene modifiers, the immunomodulators, and so the management for asthma begins with assessing the patient and their respiratory status and monitoring the severities of their symptoms, and assessing their breath sounds, having them use a peak flow, seeing what their level of oxygen saturation is through a pulse ox, and also checking their vital signs. So there are various medications that can be used for a person who is affected by asthma. Most common people hear about is the puff inhalers. The most common one is usually albuterol, but I also did make a list, so I'm just going to show you right here. So on the top of this list is all of the most common medications that are used for the treatment of asthma. And then when it comes to teaching a patient about asthma, it's important to educate the person on what the condition actually is, having them understand what the medications are that they should be taking, when they should be taking them, what they're doing for their body, how they should be used, and also when to seek emergency help. It's also important to educate them on what to avoid. So say like a person, like I mentioned, is allergic to pet dander. So obviously that's going to affect their airways and their lungs. So that may trigger a asthma attack. Also air quality. We live in Arizona. There's often monsoons, which equals poor air quality. So it's important just to educate the patient about what could possibly trigger an asthma attack with them. There is also, making regular appointments and seeing the doctor on a regular basis to have their asthma and their symptoms monitored. Again, education on how to use an inhaler properly. And also, some people have found it very useful to have a asthma diary. So, maybe they didn't realize that some things are triggering their asthma attacks. So, just kind of important for them to note and monitor, and then communicate that with their doctor. And also monitoring their breathing through PEF or spirometry, and then also knowing the red, yellow, and green symptoms of what's in the danger zone, what's in the okay zone, what's not a big deal zone. And then lastly, there are various resources that are available for people who are affected by asthma. So again, on the bottom of this paper, I did list several different asthma resources that are available. So there's the Allergy and Asthma Network, Mothers of Asthmatics, the American Academy of Asthma, Allergy, and Immunology, American Association for Respiratory Care, Asthma and Allergy Foundation of America, American College of Chest Physicians, the American Lung Association, just to name a few. And on all these different resources, there's different support groups that can be listed, education resources, and in general, just what to do if you or your child has becomes diagnosed with asthma. So this was very interesting because I didn't really know much about asthma. I've never been affected by it or like any lung issues really. So this was very educational. And although I'm quite sad my little thing did not work, and I can't figure out why, but yeah, so I don't know, but thank you. And then I will attach all of my resources to a additional document that will be placed in D2L under assignment number 1. Thanks, bye.